Okay, Lisa, it looks like we are live. Today, we are going to be having a live stream with nurse practitioner Lisa Simmons, who who I am really thrilled to get the opportunity to talk to. I'm Chris Cornell, a new health coach at Ovadia Heart Health, and I'm passionate about helping people improve their metabolic health and overall quality of life. I'm thrilled to be joining Ovadia Heart Health this month as a health coach and be part of a group that is literally changing lives. Um, so Lisa is a seasoned nurse practitioner with over 25 years of experience in healthcare. She spent her career educating and empowering patients on the importance of proactive health measures, especially focusing on metabolic health. Lisa is not only a let's see, Lisa is not her life experiences with weight loss, lifestyle changes, and discovering the ketogenic diet have given her a powerful, compassionate approach to healthcare. Her work focuses on making complex lab values understandable, guiding patients through managing insulin resistance, cholesterol, and other metabolic markers. Her goal is to move beyond treating symptoms and get to the root of health challenges, providing the knowledge and tools that patients need to truly transform their lives. Before we dive in, I'd like to remind everyone watching that while Lisa and I will be discussing health topics today, our conversation is for informational purposes only. This is not medical advice. If you're seeking medical advice or treatment, please consult with a qualified healthcare professional. And that, if you want to reach out to us, we will be sharing our contact information during this conversation. So let's get started. Lisa, let's kick things off with a little bit about your journey. Can you share what led you to focus on metabolic health and why you're passionate about preventative healthcare?
So, yeah, Chris, I went into healthcare almost 30 years ago, and mainly that my goal was to really help people. My mom was a nurse, and I used to go watch her at night in the hospital, and I always wanted to work in the ER. But my goal really at the heart was to help people. So my journey started back in 2019 when I discovered the ketogenic diet. I'd like to say a seasoned yo-yo dieter. I've probably tried everything out there. Everything that came out was, I tried all of it. But till I actually did the ketogenic diet and was able to lose weight and focus on whole foods, that was a game changer for me. I always felt hungry. I would be the type that the 6 small meals a day, and I would want to, I would wait, I'd eat breakfast and, that heart healthy oatmeal I'd have for breakfast. And then by 10 a.m., I'd be starving. But once I found the ketogenic diet, I found that I could actually lose weight and not be hungry. So it really got me kind of down the path of wanting to share that more with other people because it really helped me out a whole lot. So, and that's kind of led me down the metabolic path. I actually got my certification as a ketogenic nutrition specialist because I wanted more knowledge, more understanding, and more of really what goes on inside the body so that I could better explain it to other people.
So what were the biggest things that you learned as when you found the ketogenic diet and when you started seeing the results for yourself? And maybe what are some of the biggest mistakes you see people making who are in the position that you were once in?
I think that people tend to think if that says keto on a box, or they kind of still go down the route of ultra processed food, even though it says that it's ketogenic, or you can do this or that, and not really focusing so much on the whole foods like they should be. As humans, we're meant to eat protein and fat, and I mean, I'm older, so I've been through the realms of everything should be low fat, non-fat, and that's kind of why I never really lost weight. I would lose a little bit and I'd be starving, and then I'd gain it all back. But getting people to understand that it's still about the focus on whole foods. Like if it has one ingredient, you should eat it. But the main emphasis should be on protein and fat, and just kind of sprinkle in the veggies and the fruits if that's what you choose to do.
So what are some of the ways that an individual's life might change if they can figure out how to address some of these things? You mentioned changing the types of foods that you're eating, and I think you've talked a lot about satiety and hunger. Um, what happens when you start eating real whole foods as opposed to the junk that we typically pick up in the supermarket or the warehouse store?
Yeah, the biggest thing for me was I wasn't hungry. And when I just literally eat just protein and fat, I'm not hungry. So the change in my overall feeling when it came to food, because when I was doing all of the other diets where I was doing more of calorie restriction and focusing more on the low calorie, which they would think would be, the carbohydrates, I would burn through those so fast. So food was it was at the front of my mind all the time because I was hungry. So now over the last 5 years, I eat, but I eat more as nourishment for my body. I don't, once I eat, it's not like I'm thinking, oh, I get to eat again in a couple hours. I just listen to my body and I eat when it tells me it's hungry. So that it's been a different kind of relationship with food than I used to have.
So is it fair to say that you did a lot of calorie counting and restricting in the old days?
Oh, definitely. Sure did. So, and it did not work well for me. So,
And do you find that people have their doubts when I assume you tell people what they might expect when they make these changes? Do people look at you with a little disbelief when you tell them what they might experience if they make some relatively straightforward changes to their diet?
I think some people are afraid to do it because, again, over these, past 50, 60 years, we've been told that fat is what makes us fat, right? So, kind of trying to change your mindset and get understanding that your body requires fat, it requires protein, animal protein, right? So, when we're looking at that, and that, really it's not, getting over that fear of fat and realizing that fat is what keeps you full and it doesn't make you gain weight. It's actually the sugar that causes you to gain weight and causes so many other chronic illnesses. So when you think about insulin resistance or you think about inflammation, we know that sugar. When people start to really want to know about the root cause to what is going on, it's kind of, you have to peel back the layers and really look at what are you eating, how much are you moving, how are you sleeping? That's huge too, right? And then also dealing with stress.
Oh, that's a great point. And I wanted to ask you about some of those things. I know that part of what you specialize in is lab work, analyzing lab work for clients. And I also know you know a lot about hormones. And hormones are pretty complicated, and there's a lot of them. Well, maybe we take the hormones first and tell me some things that people might not understand about hormones. What are some of the hormones that we're interested in? And then kind of move into the lab work a little bit and tell me what one could learn from getting a good set of lab work
Mm-hmm.
And then how you might help them understand those lab values.
Right. So with hormones, I hear about that all the time because women come in and see me and they go, oh, my hormones are out of whack. That's what the problem is. That's why I've gained weight and I have this belly fat and I have these issues. But again, it's not just estrogen, progesterone, testosterone, right? We have to think about all of the hormones. And our body is run on hormones. So you have to think about ghrelin, the hunger hormone, right? When your stomach is empty, it's going to be growling, right? And then leptin is more of the satiety hormone. If the leptin's a little bit higher, you're not going to be hungry, right? But how do we get leptin to be higher than ghrelin, right? Fat and protein, going to get that leptin up a little bit. You're going to feel a little bit better. You're not going to be hungry. And then thyroid hormones as well. They really do help, and if you're fatigued and things like that, people always think, oh, it's my thyroid. My thyroid must not be functioning as well. But you have to look at everything and what would be causing the fatigue and getting down to that root cause. So is it hormones? Yes and no, because then again, we talk about insulin. Insulin is a hormone, right? So insulin, when you cause your body to, your blood sugar rises a little bit because you're doing a lot of carbohydrates. And let's say you're doing the 6 small meals a day and you're eating really healthy, right? You have your healthy oatmeal, which we know is really not truly healthy because it's carbs, right? But when people are doing a lot of carbs and you're causing a glucose spike or blood sugar spike, insulin is excreted. The whole purpose of insulin really is to drive glucose into the cell for energy, right? Because we hear you need to have carbs for energy. But really what it's also doing is there's two pathways that you can use for energy. You can either use your fat for fuel, or you can use glucose for fuel. But if you do spike glucose or blood sugar and you spike insulin, it's going to block the other pathway, right? So understanding kind of how your body utilizes that. Insulin is important. You need it to keep your blood sugar down. You need it for certain things in your body. But if you're going to continually spike it, that's where we get insulin resistance, right? It's kind of, I kind of use the analogy of the boy that cried wolf, right? If anybody knows that story, that, you know, the boy goes and runs to everybody and he wants to, you know, he can get their attention, get their attention, get their attention. Eventually, when he really needs them, they don't listen, right? So it's the same type of thing. You're spiking insulin, spiking insulin, spiking insulin. Eventually, those receptors become deaf to that signal, right? So it's kind of the same concept. So, and then when, you know, reversing insulin resistance, again, but knowing that when you check your labs, kind of rolling into the lab thing, when your doctor doesn't really explain to you a lot of things. I know on a regular lab results, we're going to do your complete blood count, and we're also going to be doing your comprehensive metabolic panel. And, you know, doctors also, not all the time, but check your hemoglobin A1C. Well, this is actually a measurement of what your blood sugar is running over a 90-day period, right? But I think the more important thing to check would be a fasting insulin, because that's going to let me know really what is your insulin level. Because getting to understand that before your A1C actually gets to what we would call the pre-diabetic stage, which would be a hemoglobin A1C of 5.7 or higher, right? But what we want to do is, what if we checked your insulin and we realized you were insulin resistant? Because you can be insulin resistant for 10 to 15 years prior to your A1C ever going into that pre-diabetic stage. Right?
Pardon me for 1 second. Can you explain to the listeners? There's over 300 people listening right now, and I want to also mention that if anyone has any questions, you can drop them in the comments on YouTube and on LinkedIn, and we'll try to check the comments, if any, on X as well. But I was wondering if you could explain what the A1C is,
Mm-hmm.
and then also tell us about the possibility of somebody improving their insulin resistance, and the most important steps they can take to do that.
Right. So the A1C is actually, it's a measurement of your blood sugar or blood glucose over a 90-day period. It's an average of what your blood sugar has run over that 90-day period. So how would you, so say you go and you get your blood tested and you do a fasting insulin and your insulin is high, right? So what would be the next steps for that? To be able to reverse insulin resistance, to even prevent going into the pre-diabetic stage, you would want to focus on protein and fat, because we know, again, to be able to be insulin resistant, you have to be kind of spiking blood sugar all the time, because then insulin gets excreted, right? So it's kind of how that works. But if you are eating protein and fat, your blood sugar stays very stable. And so you're not going to get that spike. So what that's going to do is that's going to allow you to actually use your own fat for fuel and to be able to lower what your regular blood sugar is doing. Because if you're doing a lot of eating carbs in the form of, you know, junk food over the counter, ultra processed food that comes in a box, again, if it has ingredients that you cannot pronounce, you don't want to be eating it. We want to stick with whole foods that has one ingredient in it. Makes it very simple. You know that you're going to be getting nutrients, vitamins, minerals, everything that your body's going to need from those. Right? When you're eating the stuff that down the center aisles of the grocery store that doesn't really have a lot of nutrients to it, right? So I'm going to tell you, and most of them have at least 3 to 5 different types of sugars in them that you wouldn't even know, because there's over, gosh, I think there's only 75, over greater than 75 names for sugar now. So it's really, you know, basing what your body needs. It's like putting fuel in the tank of your gas tank of your car, right? You're going to either use diesel or unleaded. That's what your car is going to take. So you need to put in it what it needs to run efficiently, right? You're not going to put sugar in the gas tank. So why would you put sugar in your body? And you want to be able to actually feed your body what it needs to be able to function the best that it can for you.
How much improvement can somebody make? Say you're in your 40s or 50s and your health is poor. You're not doing well on a lot of the metabolic health markers. Um, how long might it take for someone to start making significant changes, and what kind of improvements could they expect?
You just have to start, right? It's different for everybody. Again, we always talk about being the individual. Everybody is an individual. So looking at each individual as an individual is what we need to do. And working with somebody that understands metabolic health, I think with Ovadia, that's what we've seen. We've seen a lot of people, they come to us because their doctors don't listen. Their doctors don't explain. They don't break things down. And that's what I do when I do lab results. I break it down. When I go through a lab review with somebody, it takes an hour, because what we're doing is we're breaking down all of the different labs that we've done, which is pretty extensive because, again, we're focusing on your metabolic health. Now, you can't go by what somebody looks like on the outside, right? So, you may still be carrying a little bit of weight on the outside, but be metabolically, very healthy on the inside, right? So it can be very deceiving. And then you can actually be very sick on the inside, but be thin on the outside. So people don't understand that when you break down the labs, you go through each one. And then at the end of my lab reviews, depending on what we find, and then I can actually come up with a plan. And how can we improve on the numbers that need to be improved upon? And so they can walk away with that.
Now, I know a lot of people that come to Ovadia Heart Health, just by the name, Heart Health, you've got a lot of people that are concerned about the health of their heart. And I know there's a lot of misconceptions about cholesterol, LDL. And I was wondering if you could maybe address a couple or a few of the misconceptions people might have, and misconceptions about what are the most important things to focus on, because a lot of mainstream medicine seems to be hyper focused on trying to lower the cholesterol as the be all end all. Can you try to clear that up a little bit and explain what you might go through with somebody and what factors you would think are important?
So when I look at cholesterol, obviously the biggest one that they look at is LDL. That's the one everybody talks about and gets afraid of, right? But we look at the total cholesterol, we look at the LDL, but what we really fixate on is your HDL to triglyceride ratio, right? You want your triglycerides to be below 100, and you really want to get your HDL up. And it's about the quality of your cholesterol. So if you've never had particle sizing done, that you actually get to where you break it down and do you have more big fluffy particles or do you have more of the small dense particles, right? So getting the particle sizing and looking at really what the quality of your cholesterol is, the type that you have, it is so much more important than actually looking at the quantity, looking at the numbers. So that tells us a whole lot more than just what the number is, because it's you want it to be more of the big and fluffy and healthier looking cholesterol. Again, people understanding that cholesterol is important for immune function. I do hormones, so it is really super important for sex hormone production. And also too, your brain health. So, if people are worried about it, they really do need to get particle sizing and really see where they stand when it comes to the type, the quality of their cholesterol.
So I guess what I'm hearing you say is that there's a lot more nuance than maybe most people understand from the simple labs that they might get at their regular annual physical or whatever. Are there special recommendations for what types of lab work you need to get tested? And is that something that you provide to people that are going to come? You tell them what they should get tested?
We have a whole panel that we run. So again, when we're talking about the basis to chronic disease, which is going to be inflammation or insulin resistance, or both, you can have both, right? We do have a pretty extensive lab request that we send out to the patient and have them complete, because it's never just one thing, right? I can't just tell you to eat this way or do this or whatever, but we really want to see metabolically what's going on the inside. So we do inflammatory markers as well. And we also look at the quality of your cholesterol, and we look at, your kidney function, your liver function. We look at everything to get a better idea of really what's going on the inside, and giving you the best idea on how to improve them, is, a plan, I should say, so that we can help you. And then at Ovadia, we do labs every 3 months for our patients, because you want to be able to follow trends. You don't want to just do a snapshot in time, because if you're trying to make improvements, you want to see if those improvements that you're doing are actually working and doing what they're supposed to be doing. So, and that's usually how we do it.
Okay, so we've been putting on the screen how you can get in touch with a member of our team. You can go to ifixhearts.com/talk to talk with someone and setting up an appointment. And you can also call our number, 503-STAY-OFF. Lisa, you said that your lab work of consultations can take up to a full hour, and it's a comprehensive deep dive about someone's lab work, and you'll give some idea as to what someone might do to try to improve that lab work over time. You also meet with patients about other things. Can you describe, what someone would get from a consultation with you? And I know that people can also book a consult with Dr. Ovadia, and that you work closely with Dr. Ovadia. It's a team that has Dr. Ovadia, who's a cardiac heart surgeon. We've got health coaches. We've got a registered dietitian. And just explain to me a little bit about what someone might get doing a consult with you that goes beyond lab work.
Looking at the full picture and what's really going on with the patient, a deep dive into what they've been doing, where they're at, what the goal is, mainly it's metabolic health is what our main goal is. But the thing is, I always say you get a nice side effect of weight loss, right? Because again, it's not going to be the quantity of years you live. It's going to be the quality of years that you live. So you definitely want to, we do a whole comprehensive review of everything that's going on, just like you would when you go to your doctor. They ask you all of the questions and everything, but ours is more based on, giving the power back to the patient, right? I'm not just going to give you a pill. I want you to do some work, right? If you want to make the changes, it's lifestyle. And that's really where we start at. Not that, medications aren't used on occasion, but very rarely. Our goal is really to get you off medications and really getting back to being truly healthy and using food as thy medicine.
And what about people that have some serious concerns about their cardiovascular risk? Tell me about some of the other changes that they might make, especially through consulting with you or Dr. Ovadia, that go beyond diet. Diet obviously is extremely important, a foundational element. What are some of the other things that you talk about? Just kind of touch on that to give people an idea what they might expect.
So besides just labs, it's we touch on different things that are going on with the patient. I think the biggest is working very closely with our health coaches, because they have a wealth of knowledge. So we also work as a team. So, I may see a patient that Dr. Ovadia has seen, and we kind of tag team on patients, but it's really just figuring out what the patient is needing at the time, breaking it down, and then coming up with a plan with the patient involved in there. So when we're visiting with a patient, it's, I'm always asking them questions. and I want them to ask me questions. I want them to fully understand when we're discussing something, what the plan is going to be when we're done. And then they have things that they can, take away from it that they can be doing. Because I can't do it for them, right? I can make suggestions, I can give them ideas and stuff, but it does take work because it is more of the lifestyle. So it's not just going to give you a pill or a potion or anything like that that's going to put a band-aid on it. It really is getting to the root cause. And depending on if they already have diabetes or they already have heart disease, what are going to be the things that are going to best, put it kind of, so it doesn't get worse, right? If you have heart disease, we just don't want it to, keep going, getting worse, right? So what are the things that you can be doing? But we want to give you a really good plan of action to be able to do the things that need to be done. So, but looking at the whole big picture again, it's going to be nutrition, but it's also going to be exercise and stress and sleep. And I will tell you, our health coaches are fantastic. And we all work together so well that we discuss patients weekly to make sure that if there's something going on with a patient, that everybody's on board and we know what's going on with that patient, and putting our heads together so that we're doing best by the patient.
As someone who personally weighed as much as 278 pounds, and at one point in my life, maybe 10 years ago, I didn't think it was realistic for me to make a change as significant as what I've experienced. And I know, you've had your own personal successes, and now you are, you're working with patients who are doing the same. What can you tell someone who is trapped in that feeling of that it's never going to happen, and other than just do something? Is there any sort of advice that you have to get past that feeling? The feeling that I know, I can remember well, like, no matter what I do, because I was trying calorie restriction over and over again, and I would lose as much as 50 pounds and then gain it all back. And I've now talked to, literally dozens and dozens of people that have experienced the same. What's your best advice for somebody that has been struggling for years or decades or longer?
It's really getting into the mindset. Mindset plays the key role, but just really starting to look at food more as fuel than as enjoyment. I really think that we've, in our society in general, we place such an emphasis on food. And if we look at it differently, like when you're eating something, is this really got the, vitamins and minerals and nutrients that my body needs, or am I feeding an emotion? Right. So, and then really listening to your body when you're hungry and just starting. So I always say, if you start today, where are you going to be, a year from now? And it's baby steps. It's like, start introducing more protein. We know that you need protein and a little bit of fat. Don't fear fat. Right. And I'm talking about good fat that comes in the form of the animal protein, and good saturated fats like butter. You can use olive oil, you can use ghee, lard, tallow, things like that. So, and understanding that those things are going to keep you full. And it does start with, getting kind of over the fear. And it is kind of a fear, like if you've done it multiple times, that you're just, I'm going to do this, I'm going to lose a little weight, and I'm going to gain it back because that's what I've always done. But I'm going to tell you, when you're eating food that really gets you full, and you're not really fixating your whole life around food, it can be a game changer.
I know we're coming close to the end of our time here, and we now have nearly 500 people listening, and this is great. If anybody has a question, feel free to drop it into the comments on LinkedIn or YouTube. But we are only got another minute or two. I just want to get your quick thoughts about the community that we have, the Heart Health Hub community, and I'm going to put up the URL for anyone that's interested. But I just wanted to say a few words about the community, which has weekly meetings. And I know, Lisa, you have made big contributions to a lot of the presentations that go on the Monday night meetings. And then there's a place where people can connect throughout the week. What have you seen about the Heart Health Hub community that you think might give people some extra support on their journey?
Well, it's a group of like-minded people. So sometimes it's hard when you are doing something and everybody around you is going, "Oh my gosh, if you do that, you're going to die. I wouldn't do that." So we have a group of people that have been doing this. They're keto, they're carnivore, they're still on their journey. Or maybe they've lost a bunch of weight, but they just want that community. It is wonderful. I love leading community. We do have a meeting every Monday night. It's a lot of fun because people they ask questions. Of course, it's not medical advice, but it really something may have come up and they just have questions and they just want it they want an answer from somebody that thinks like they do or is doing what they're doing. So it makes it a little bit easier. It is really enjoyable. We have a lot of great people in the group and a lot of support, and they ask each other questions and answer each other's questions, and it really just is a wonderful place to just feel supported.
Oh, thank you so much. I always enjoy talking to you, Lisa. You're like a wealth of information. I've had the privilege of getting my labs reviewed by Lisa, and it's just fascinating, the depth of information that you can get when you go to the right person. One more time, I'm going to put up the. Let's see. We'll put up the easy URL, ifixhearts.com/talk. Simple way to get on a calendar. You can schedule any sort of consult with Dr. Ovadia, with Lisa, with any part of our program. So just ifixhearts.com/talk. And it's been a pleasure talking to you, Lisa, and I look forward to getting the chance to do this again.
All right. Thanks, Chris. Good to see you again.
All right. Take care.
Bye-bye.